Honest, nursing homes have been the ground zero of the COVID crisis. 1,543 people have died in nursing homes since the start of the crisis. 369 people have died in nursing homes with COVID just in the last month. My deepest sympathy goes to each and every one of those families. I'm not aware, Taoiseach, of so many people dying so quickly in any other institutions in the history of this state. In the month of January, COVID has been out of control in nursing homes to devastating effects. 193 outbreaks in 1 month, Taoiseach. Now, we in Aontú have been calling for a public investigation into what's happened in the nursing homes since the start of last year. We did so that the state would learn from the mistakes made and make sure that they prevented them in future. The investigation didn't happen and the mistakes were repeated, Taoiseach. In the last couple of days, I've reached out to many nursing homes around the country, and I'll have to say that the reports back from those nursing homes have been devastatingly uniform. The delay in the vaccine has led to hundreds of deaths, is what I'm being told from the nursing homes. So take the Green Park nursing home in Tuam, for example, which survived thus far without any infections, only to witness 35 of the 49 residents to test positive in the week that they were due to receive the vaccine. 1/5 of those residents have now died. In Blackrock Abbey near Dundalk, 14 people have died, one man dying just a week after receiving the first dose of that vaccine. Nazareth House lost 11 people to COVID in 2 weeks, and I'm told that the cemetery for those men that died in Nazareth House is akin to a war grave at the moment, Taoiseach. And these deaths happened just before the vaccine was to be administered. It took 2 weeks from when the vaccine arrived in Ireland until that they were first administered in a nursing home. That's a scandal, Taoiseach. Why did it happen? Why were just 10% of the initial 77,000 vaccines administered by mid-January administered in a nursing home? That's a scandal, Taoiseach. Who is responsible for it? It is heartbreaking to see the devastation that has happened throughout the nursing homes, right up the length and breadth of this country. And those nursing homes are still in crisis. But what's doubly heartbreaking is many of those deaths could have been prevented. They could have been prevented with timely action with regards to these vaccines. And yet from the Minister for Health, every single interviewer struggles to get a specific date in which vaccines will be rolled out. Why is the Minister for Health allergic to specific dates with regards to delivery of vaccines, especially in nursing homes?
Thanks very much, Deputy. More than 3,000 people in this state and nearly 5,000 people on this island have lost their lives as a consequence, or at least with COVID-19. And our condolences go to all of those families and all those families who are still grieving in Ireland, north and south. Sadly, it is the case across the developed world that a very high proportion of people who have died of COVID or died with COVID were residents of nursing homes. And Ireland is not unique in that regard. Even in countries where they've had very low deaths, like Norway and New Zealand, for example, the majority have occurred to residents of nursing homes or care homes or rest homes, as they use the term. And it doesn't always mean a failing on behalf of the nursing homes or the people who work there or the health services or the state. The truth is people who live in nursing homes tend to be very elderly, tend to have underlying conditions, and therefore at higher risk of getting very sick and dying if they get coronavirus. And once coronavirus is prevalent in the community, it's very hard to keep it out of a nursing home, in the same way as it's not possible to keep the flu out of the nursing home in any given winter. For exactly this reason, because nursing home residents are at such high risk of getting sick and dying from this virus, they were the group that was prioritised for vaccination. The decision was made to prioritise 2 groups, nursing home residents and staff, because nursing home residents are at the highest risk of dying from the virus, and our healthcare staff, because they are at a very high risk of contracting the virus and getting sick from it, and we need them to stay well so that they can staff our hospitals and nursing homes. Those 2 groups were prioritised ahead of anyone else. Lots of other countries gave vaccines to politicians, to government members, senior officials, you name it, ahead of nursing homes and healthcare staff. We took a decision in this country to prioritise our healthcare staff and nursing home residents and staff, and I believe that was the right decision. I think it's a little bit simplistic and not entirely correct to say that had the vaccines started a week or two earlier in nursing homes, that lives would have been saved. You can't say that definitively. Bear in mind, it's only 2 or 3 weeks after you get the first dose that you get protection, and only 2 or 3 weeks after the second dose that you get full protection. So I don't think you can necessarily draw the conclusions that you draw. But in terms of responsibility, the decision on prioritisation was made by the National Immunisation Advisory Council with the support of NPHET. The practical rollout of the vaccine was carried out by the HSE. And I think in fairness to the HSE, they've done a really good job. Once they've got the vaccines, they've got them out to people. And it is a shame that we didn't get the vaccines a month earlier or 2 months earlier, but we didn't, and those things weren't under our control.
Taoiseach, if you want to contradict the medical professionals that I've spoken to in some of these nursing homes with regards to the timing of the delivery of vaccines into those nursing homes, you can. But timing is key, and every single nursing home that is experiencing the wave at the moment will tell you that timing has been absolutely shocking. It couldn't have been worse with regards to timing that's happened. And the rollout of the vaccine in the first number of weeks in this state was scandalously slow. Now, just another question. The other issue that comes up with nursing homes is the fact that they are struggling with regard to staff. Nursing home after nursing home will tell you that any of their staff gets COVID, they are wiped out. They struggle to get replacements. I've asked you about the Be On Call for Ireland. You've given me loads of excuses why that hasn't been used. I got a PQ back this week, Taoiseach, which says that there are 680 people on the Be On Call database that are job ready. They're ready to go. How can a human resource so critically needed in one hand be available and not be used by the state in a sector that is experiencing so much death and destruction?
Thank you, Deputy Taoiseach.
Thanks, Deputy. The sad fact is it could have been worse. It could have been much worse. Many countries around the world haven't even started their vaccination programmes yet, and most EU countries are well behind us. We're in the top 3 or 4 European countries now in terms of the speed of the rollout. Yes, there are countries ahead of us, the United Kingdom, the United States, Israel, for example, but those countries are not part of the European Union, and the vaccine was approved earlier there than it was here, and that is not something that was under our control as a government. But as things stand, in the vast majority of nursing homes, the vast majority of nursing home staff and residents have received the first dose of the vaccine. Some have received a second dose. In some cases, it wasn't possible to give the vaccine because either the residents had the coronavirus at the time, or were sick or ineligible for another reason. And now the HSE is going back again, sweeping back to about 100 nursing homes to make sure that they vaccinate anyone who was missed or anyone who could not have been vaccinated earlier.